I'd like to welcome you to today's brief health update on the novel 2019 coronavirus. This is Dr. Paul McKinney, Director of the Center for Health Hazards Preparedness in the School of Public Health and Information Sciences at the University of Louisville. Wuhan China is where it all appears to have begun, probably sometime in December of 2019, when cases began to appear in and around a live animal market in the city of Wuhan, which is a major industrial area, a center of commerce and transportation, located on the Yangtze River, a major river port, and a city of 11 million individuals. Since that time, and beginning in January, we've heard a great deal more about coronavirus and have seen many images emerging from China, especially regarding individuals who are being screened with various devices, thermal imaging devices, heat sensing devices to see if they have fever associated with coronavirus, being screened at airports, at train stations, in other public places. And of course, the ubiquitous sign that people are concerned is the wearing of masks by virtually everyone that we see on the streets, children, adults, authorities, and average citizens alike. We're also seeing images of people being quarantined aboard ship, major quarantines in place now in Japan and in the Hong Kong area, where large numbers of people aboard ship where cases of coronavirus have occurred is still ongoing, and the quarantine period for this virus has been enforced pretty much universally at 14 days. Although we believe that the average incubation period may be shorter, perhaps around 5 to 7 days, but in some cases as long as 14 days, and that is that outer limit is being used to help reduce the likelihood that any cases will escape that observational period. Why is this virus called a coronavirus? This is a diagrammatic look at the virus and by CDC, where the center, a dark sphere, is the virus particle itself, and on the surface there are those red spikes that project outward. Those spikes are the attachment points for the virus onto the lining of the respiratory cells in humans, allow the virus to attach and enter the cells. But when you look at it under an electron microscope, all you can see is kind of a halo or a wreath or crown around this central particle, and that has been described as a corona, and therefore the virus was named as a description of how it appears, again, under an electron microscope. Is this the only coronavirus that has been around that we know about? Certainly not. There are 4 others on this slide, numbered 1 through 4, that have been known for some period of time and are thought to cause predominantly mild cold-like infections, simple upper respiratory infections that are of little consequence. But in 2003, we learned of a new variant in the coronavirus series called SARS. That virus, which stands, of course, for severe acute respiratory syndrome, caused havoc in China and concern around the world for a period of time. It first was recognized in the West probably by February of 2003, and by July 2003 had pretty much disappeared. No additional cases were seen beyond that point. The U.S. Essentially dodged that potential bullet, so to speak, because we did not have any transmission of SARS within the U.S., although just north of our borders in Canada it was a major problem. Total number of cases of SARS worldwide were in the 8,000 range, certainly much less than we're seeing currently with coronavirus, but it was a much more severe disease as well, with mortality rates that were substantially higher than we're seeing with the current coronavirus. And then several years later, the Middle Eastern respiratory syndrome virus, MERS, appeared. Most of the cases of this disease have been seen in the Arabian Peninsula and the areas adjacent to it, although there was also one outbreak in South Korea from somebody who had traveled to Saudi Arabia. There are a couple of cases in the U.S. of MERS as well that were recognized in travelers, but no transmission person to person within the U.S. that we have seen subsequently. So now we have the third coronavirus that we know causes severe illness in humans, and this one has a fairly bland sounding name of 2019-nCoV, which is novel coronavirus, although some people informally refer to it as the Wuhan coronavirus. That's not the official name. And how serious is this in comparison? Well, we'll take a look. We know that there have been official declarations already by major international groups like the World Health Organization, which declared a global health emergency on January 30th. This is a photo of the Director General of the WHO making that proclamation. So the level of concern certainly rose by that time. Actually, on the following day, January 31st, the U.S. declared a public health emergency for the entire U.S., and screening measures were put in place at numerous sites, especially predominantly in the beginning at airports, on the major airports that were seeing travelers arriving from China. How is the coronavirus spread? This is spread in a fashion very similar to most respiratory viruses that we know about. Like influenza, it usually requires fairly close contact, distance of around 6 feet or within 6 feet to be readily transmitted. It's primarily transmitted by respiratory droplets that are formed when someone coughs or sneezes, and also possibly by contamination of surfaces with secretions from the respiratory tract. If someone coughs or sneezes onto a surface and somebody else touches that surface and afterwards touches their nose or mouth or eyes, it can be inoculated into their body and cause infection as a result. And so how to prevent infection? Clearly, if there are other people that you know about who are likely to be ill, you should avoid close contact with them. And in the U.S., the quarantine process for international arrivals and the isolation of those who are known to be ill is hopefully going to solve that, at least in the near term for us. In cases where you yourself might be coughing or sneezing, make certain to cover your nose and mouth when you cough and sneeze. Avoid touching your eyes and facial area. Clean and disinfect surfaces and any objects that might be contaminated with bacteria or with viruses, in this case, other germs. Wash your hands very often with soap and water for at least 20 seconds. And if you don't have that available, use an alcohol-based rub with at least 60% alcohol. That is not preferable, of course, to hand washing, but maybe the only thing that one has that is a reasonable substitute for hand washing in situations where sinks are not readily available. What can be done to counter the coronavirus? Otherwise, antibiotics? No. This is not a bacteria, so antibiotics are definitely not effective. Vaccines? Not yet, at least. We know that a vaccine won't be helpful in treating the disease. Conceivably, if we get one in the reasonably near future, it could be helpful in preventing disease. But the projections about when a vaccine might be online vary very greatly, and may not be reasonable to expect one for months to perhaps a year or more. Antivirals, though, are out there that are effective against other viruses, and there may be a combination that's found that will be effective. There's nothing that's been recommended currently that's proven to have special benefit against coronavirus, at least not at this time. Are there methods for earlier detection of the virus? Fortunately, yes. The CDC, until this point, has been running all the tests themselves, and now they're going to be rolling out the capability for those tests to state and local public health laboratories, which is extremely fortunate because that should diminish the turnaround time and allow people to be diagnosed more readily. and handled appropriately in a more expeditious fashion. But in the meantime, the recommendations from CDC and from Health and Human Services within the U.S. Are, number one, not to travel to China at this time for obvious reasons. There's no reason to wear a face mask in public because that's not been proven to be effective in any case in most situations of this sort, and there's not circulation of virus in the public here in the U.S. at this point. And it's also important to remember not to show bias towards Asian individuals by assuming that they all have the virus, because of course that is clearly not the case. Cases confirmed globally. This map will be changing probably every day as the outbreak continues, but certainly there are widespread reports in many continents, certainly in Asia, also Australia, Europe, and North America at this time. In the U.S., we have cases on both coasts, as well as in the center of the country, in Illinois, as of this map reported by CDC on February 5th. But perhaps the most enlightening information of all is this particular graph, which may be hard to interpret at first, but it shows in the vertical array the estimated case fatality ratio for a number of viruses that we know about, that is, of the people who are infected, how many die. And then on the horizontal axis, it shows the reproduction number, which is the infectivity of the virus, how many individuals the average infected person will actually infect themselves. So how sustainable is the virus based on how many people are going to be infected when any case occurs. So if you look in the vertical direction, that red box in the lower left-hand corner is the range for the current estimates for coronavirus, and you can see that the mortality, which again is in the vertical direction, is relatively low compared to others that we know. It's certainly above that of the common cold. It's above that of usual seasonal influenza. It's in the same range as swine influenza reports we've seen before. Again, this range currently is in the 2 to 3% range, roughly 2% right now. Above that substantially are the Spanish flu of 1918. That was the worldwide pandemic that may have killed 50 million or more individuals. The estimated mortality rate and case fatality rate in that global pandemic was around 10% by many estimates. And then if you go further up, you'll see the dot for MERS, Middle Eastern Respiratory Syndrome. The case fatality rate's very high there in the 33% range, and for Ebola, 50%, and even higher. The current outbreak in the Democratic Republic of the Congo has been closer to 66%. So this virus, the coronavirus, is much less dangerous in terms of mortality than many that we've seen, but it's certainly more than the common cold, more than seasonal influenza. If you look on the horizontal axis, how transmissible is it? Again, it's about as transmissible as the swine flu has been in the past, but not as transmissible as things like SARS, going to the right there, or chickenpox or measles, which are substantially more dangerous in terms of the number of people infected by any given case. And so thank you for your interest. We hope to have ongoing updates for you on the coronavirus as they become available. And that concludes this presentation. Thank you.